The overall history of the human story is taking steps up a staircase toward better health, more prosperity. And in the last year, in terms of health, we fell down that staircase.
Last year, Elon Musk and DOGE dismantled an obscure government agency called USAID. I was in that room in Washington, D.C. with John Green. We were explaining the collapse of American global health programs. The more you know about John Green's journey into global health, the more you'll understand how hard it is to climb that staircase and how easy it is to come falling back down again. To millions of young people, John Green is known as the best-selling author of the novel The Fault in Our Stars, and also the co-creator, along with his brother Hank, of one of the first YouTube channels, Vlogbrothers. Over many years, he has built an educational empire, including the very popular Crash Course, free on YouTube, and taught in thousands of classrooms nationwide. But in 2019, he visited Sierra Leone and brought along his community, Neurophiteria, to meet a patient called Henry.
In 2019, I visited the Leone Tuberculosis Hospital in Sierra Leone and met this boy, Henry, who shares a name with my son and seemed about the same age. Henry immediately began walking me around the hospital, showing me the grounds and introducing me to various staff members, and I thought he must be like a child of a nurse or something. But when I spoke later to one of the doctors, he told me, Henry is a patient and one we're very concerned about. It turns out that Henry was not 9 years old like my son. He was 16. It's just that his body had been ravaged by tuberculosis.
Henry was very sick with drug-resistant TB. I'm sure he was very infectious at the time that John was shooting this video. Henry wasn't being cured by the standard regimen, so his doctors wanted to try something new. And the problem was that these drugs did not exist in Sierra Leone.
But as Dr. Tefera told me, in the field of TB, you have to keep trying. So he called his colleagues at Partners in Health and the Sierra Leonean Ministry of Health, and he was like, look, some of the drugs we need are in Liberia, some are in Lesotho. Is there any way that we can get them here together to help save this kid? Yes, it's only one kid, but like, tell that to his mother. And maybe this one kid can be the first of many.
It's kind of hard to make an argument that you have to treat this patient, this one patient, with a regimen that doesn't even exist in the country. And then again, maybe it's not hard at all.
I came home from that trip just obsessed with tuberculosis, a disease that despite usually being curable still kills over 1.5 million people per year, more than are killed by malaria and HIV combined. And I spent the next few years trying to learn about the disease, and along the way I often thought of and prayed for Henry, but I never had the courage to ask my friends at Partners in Health what had happened to him. But finally, when Sarah and I returned to Leone in 2023, I asked one of the nurses there, do you remember a patient named Henry? And she said, Henry? Of course, he's here today. He wanted to visit to see you.
Hey, good to see you. Yeah. Oh,
he's now in university.
Oh, great.
Yeah.
All right. Yeah, chosen.
Henry became the first person in Sierra Leone to receive the bedaquiline-based cocktail, and he improved extremely quickly. Dr. Tefera told me that it was like magic. Within 3 weeks, he went from what would have been his deathbed to walking and talking and laughing, and eventually he was cured. And after more than 2 years at Leone, he was finally able to go home.
Now I'm back to pursue my dream to achieve it. I'm so happy to be alive again.
I recognize this story. I started treating drug-resistant TB patients in 2001 in Peru. And the main difference back then was that far more patients died. The story of how we got treatment for drug-resistant TB is a microcosm of the story of how we climbed the stairs for global health. We had to figure out how to get the drugs, deliver them to patients, support the patients during treatment. We even had to run our own clinical trials for drug-resistant TB because the old regimens were so bad. That story, that slow climb up the stairs, has been repeated for many other diseases besides TB.
If the New York Times were to report the most important story of the day, I would argue that for the last few decades, every day on the front page of the New York Times above the fold would be the headline, "Fewer children died today than any day in the last 6,000 years."
The statistics support what John is saying. In 1990, 13 million children died. In 2024, less than 5 million. And that statistic includes the entire world, even very poor countries or countries going through famine and armed conflict. Treating sick children in these settings is incredibly complicated. Does this child have cerebral malaria or pneumonia or TB? Maybe dehydration from diarrhea or just being very malnourished. Maybe all 5 of those things are going on at the same time. This child should be in an ICU in Boston, and all this clinician has is a stethoscope. It wasn't just one drug or one intervention, it was everything. Malaria treatment, insecticide-treated nets to protect children from mosquitoes while they're sleeping, antibiotics for pneumonia and TB, better nutrition, oral rehydration. There are still 5 million children dying each year, and that's appalling, but that's 8 million less than 1990. And do you see that line at the bottom? Death of neonates has also been declining, but not as much as for other children. And the reason is that neonatal death is very complicated. It's usually because of premature birth or complications during childbirth or right afterwards. You have to have a whole functioning chain of care that begins before the child is born.
Because to properly serve babies and new moms, the whole healthcare system needs to get stronger. We need ambulances so that people who need an emergency C-section don't have to get on the back of a motorbike. We need primary care clinics that can be safe places to deliver most babies. We need community health workers who can identify high-risk pregnancies in their own neighborhoods. And we need the Maternal Center of Excellence, a high-quality clinical facility on the campus of Koidu Government Hospital that can deliver care to babies and new moms.
John and Hank and Nerdfighteria committed to helping PIH build that entire chain of care in Sierra Leone. Over 7 years, this campaign raised over $25 million. And this is the result. The PIH Maternal Center of Excellence, a hospital that provides mothers and children with a standard of care that simply wasn't there before.
Speaking of babies, Hank, because the MCOE contains Sierra Leone's first NICU, it has already become a critical site of care for premature infants. There have been over 130 babies who received care in the NICU, and because the MCOE is a teaching facility, nurses and midwives and doctors are being trained there to take what they learn and spread it across the country.
This is what John means by climbing the staircase. Not one heroic person saving the world, but thousands of people working together to change the standard of care, the conception of what is feasible and possible in settings like this. Real changes that allow someone to live when they would have died just a few years earlier. This decades-long climb up the global health staircase was accomplished through American support, but not a mass political movement. It was a quiet consensus between Republican and Democratic presidents and members of Congress and congressional staffers who really understood what these programs accomplished. But meanwhile, the American public barely knew that the global health movement existed. And honestly, that invisibility for decades seemed like a strength because it avoided all of the partisan battles that were raging in Washington, D.C. Until this happened.
This is the chainsaw for bureaucracy.
And when Elon Musk and DOGE were done, the United States government had frozen all foreign aid, including thousands of global health programs. That included PEPFAR, which was created more than 2 decades ago by George W. Bush. HIV was killing millions of patients each year. Effective medicines existed, but even in countries with millions of HIV-positive people, very few could access them. And PEPFAR changed all of that. It paid not only for drugs, but for the entire climb up the staircase, for laboratories and testing and healthcare workers. It's credited for saving 26 million lives. PEPFAR was created by a Republican president and repeatedly funded by Republican and Democratic Congresses. Politicians who agreed on very little celebrated PEPFAR as proof that the United States could accomplish something extraordinarily complicated and extraordinarily good. And in an instant, it all changed.
$8 million to promote LGBTQI+ in the African nation of Lesotho, which nobody has ever heard of.
What Trump reduced to a punchline is just a PEPFAR project in Lesotho, a country with one of the highest rates of HIV in the world. 20 years ago, when I first started working there, the life expectancy had dropped to 38. Now, partly because of PEPFAR, it has recovered to 58. And if you remember what John said, Lesotho was one of the countries that donated drug-resistant TB drugs to Sierra Leone to treat Henry. When the political consensus about global health collapsed, politicians were free to make jokes about HIV programs in Lesotho, and the public had no competing picture in its head.
USAID has been exposed as the funding mechanism for the radical left here and around the world.
Transgender job fairs and drag shows and things like that that are absolute wastes of our dollars.
By then, dismantling foreign aid wasn't just policy, it was spectacle. And that's why John and I were speaking in DC. We were trying to talk with the people who still have the power to see what is going on, and also to possibly intervene.
There have been moments where we've taken steps backward, but in the last 85 years, this will be the biggest step we've taken backwards.
The effect of falling down the staircase wasn't obvious at the outset. Other governments and funders recognized that stopping these HIV/AIDS programs would be disastrous, so they stepped in. And even PEPFAR, it limped along because advocates really tried to keep at least part of it alive. But a year later, studies have found that thousands of clinics closed, millions fewer people have been tested, and tens of thousands of children were no longer receiving HIV treatment or PEPFAR-supported care. What happened in Lesotho wasn't just a single closure of a program in a country that no one has ever heard of. This was the slow destruction of PEPFAR itself. Once one of the proudest accomplishments of the United States government, but one that the public never understood enough to prevent it from being dismantled. Inside John's staircase metaphor is the idea that progress is not automatic. We can fall down the staircase, but we can also choose to climb it again. For decades, these programs survived because a small circle in Washington, D.C. understood them. That is no longer enough. That does not mean that everybody has to become a global health expert, but it does mean learning enough to recognize what is being broken and making sure that the people who represent you know that you're watching.
You probably feel quite powerless, I know I do, because, we all feel like, as Robert Penn Warren famously wrote, we are bubbles on the tide of empire, that the waves wash over us and we don't shape the waves. But that's of course not true, and that's especially not true for the people in this room. You do shape the wave.
John Green cannot save global health by himself. Elon Musk could not have dismantled it by himself. The staircase is still there. We just have to keep climbing it. There's a lot of crazy stuff happening in DC nowadays, and a surprising amount of it is related to global health. Subscribe, and I'll keep you updated.